Hi, I'm Kayla McKinney, Director of Health Services, and I'll be giving an overview of the Health Services Department from the 2015 to 2016 school year. What's new in our department? Over the past year, we've gained 2 new staff members. After I transitioned to the high school, Amy Hurd became our Highland nurse, and this year, Denise Lundcloud joined us as our junior high nurse after our previous nurse retired. They're both doing very well. One of our goals last year was to better utilize the technology that we have. We made a push towards making sure that all of the paperwork that we receive gets entered into Skyward. This now allows us to generate reports from the system instead of tracking data by hand like we used to. This saves a lot of time and allows us to focus on other aspects of our job. We also put a lot of time into learning the ins and outs of a system called My Service Tracker. Through this system, we are able to go in and document for services that are then reimbursed by Medicaid. And I'll talk more about this a little bit later on. We were very excited to work with the Stillman Valley Fire Protection District and the Meridian Education Foundation to offer CPR classes to all of our staff. 45 district employees took advantage of the opportunity and became CPR certified, helping to enhance the safety of our schools. Here are the nursing office visit totals from the school year. As you can see, we stay very busy with each building nurse managing over 1,000 office visits. Here are our daily scheduled office visit numbers. The majority of these numbers come from students who have diabetes, whose blood sugars need to be monitored throughout the school day, and they also come from any student who receives a medication while at school. You can see how these numbers have fluctuated over the past 3 school years. I suspect that the numbers for this year will increase as the school year goes on and as services are added. The data in this chart comes from the My Service Tracker system that I mentioned before. In the 2013 to 2014 school year, as a department, we documented for 68 services. The next year, we documented for 86 services, and last year, we were up to over 2,000 services that we documented for reimbursement for. We had additional training to learn what will and will not qualify for reimbursement. For example, if a student has an IEP and it is written in their IEP that they need to have a medication administered at school, that service will qualify for reimbursement if the student is Medicaid eligible. In the years past, it's not that we weren't providing the services to the students, but that we were not documenting in the specific system in order to be reimbursed for them. This chart shows how those services break down by school. As you can see, the majority of the services come from Mineral Center School and the junior high. This coincides with the daily office visit numbers, as most of these services are the administration of a daily medication by the school nurse. The last piece of data I'd like to look at is our Immunization Compliance numbers. These numbers reflect the percentage of students that are compliant with immunization requirements by the state deadline of October 15th of each year. If the students are not in compliance on October 15th, they are mandated by the state to be excluded from school until they are compliant with the requirements. As you can see, we remain at or above 99% compliance, but there's room for improvement. In 2014, the state added a varicella vaccine requirement, also known as the chickenpox vaccine. And then last year, the meningitis vaccine was added to the requirements. With new vaccine requirements being added, it would be in our best interest to work on providing some wraparound services to our students, such as an immunization clinic, so that we are able to keep all the students in compliance so that they are able to attend school. One of our goals is to work with the Ronald McDonald Care Mobile to bring their mobile immunization clinic to our district. We already work with them to put on our yearly dental care clinic, and we're very excited about the possibility of adding the immunization piece. So what's to come for the Health Services Department? We're learning more about the special education process and what role we play in that as the school nurse. And we've begun writing the health portions of the IEPs. We'd also like to start digging a little deeper into our office visit numbers and looking at them more on an individual basis. We plan on narrowing down those students who we see, for instance, 5 or more times a month, and then looking at those students individually to see if there's some sort of social or emotional need that's not being met, and determining what resources we can get them. We'd also like to do more with health education and get into the classroom some more and do some teaching to the students. We'd also like to expand the health services portion of the website to include some different educational pieces regarding health, and we can also work with the wellness committee to promote wellness to our staff. One of our ongoing goals is always to work towards expanding our services. One way that this can be done is through the immunization clinic that I talked about before. We're also working with the Ogle County Health Department to be better prepared in the case of a public health emergency. And in that case, we will become a closed point of distribution or a closed pod. We have an agreement with them that if a public health emergency is declared, we will be able to obtain supplies from them, set up our pod in the district staffed with our volunteers, and we will be able to distribute vaccines or medications, depending on the emergency, to our staff and their families. If we develop a plan that has enough volunteers, we can also open that up to students and their families as we see capable. This concludes my presentation. I just wanted to take a minute to say thank you for allowing me to lead this department, and I'm very excited about what the future has in store for us.